Okay, has that come up okay, guys?
Yep, it's good.
Beautiful. Okay, so welcome everyone to today's Gold Coast RACF Forum. For those of you who don't know me, my name is Katie Garrett. I'm the Acting Program Coordinator for the Gold Coast Primary Health Network's Special Project Team, which encompasses wound management, palliative care, aged care projects, and I guess anything else that we think of along the way. Just a little bit of housekeeping before we kick off for today's webinar. We have presentations from Gold Coast Primary Health Network, from the Gold Coast Health Space and RAS teams, and also the Gold Coast Public Health Unit. So the presentations will all be recorded, and we just ask that you keep your cameras off and your microphones on mute during this time. If you do have any questions during the presentations, please feel free to use the chat function. Otherwise, at the end of the presentations, once we've all concluded, there'll be an opportunity to turn your microphones and cameras back on if you'd like, and for anyone attending to ask questions and provide feedback. So the Gold Coast Primary Health Network would like to acknowledge and pay respect to the land and the traditional practices of the families of the Ugamba language region of Southeast Queensland and their elders past, present and emerging. And I would now like to welcome Matt Carradis, the CEO of Gold Coast Primary Health Network.
Thanks, Katie. And g'day, everyone. Nice to meet you, and thank you very much for giving me some of your time this morning. I'm just speaking very, very quickly just to introduce the organisation and let you know the purpose of the meeting. So, as you would know, the Royal Commission into Aged Care Quality and Safety came up with a number of recommendations which have filtered down through to each of our different organisations in different ways, and different recommendations, different strategies flowing from them. With regards to our organisation, we now have a more substantial aged care portfolio of activities based on quite a few of those recommendations and funding for those over the next 4 years. So we'd really like to take this opportunity to tell you a little bit about Gold Coast Primary Health Network, because you may not have engaged with us before, and a little bit about the programs that we'll be running. We do hope to interest you in them and to elicit your participation in some of those programs. Obviously, they're designed to assist residential aged care facilities and the staff, and most importantly the residents, but we will need to engage with yourselves to implement some of those programs. So Gold Coast Primary Health Network, this is our vision and mission statement, so building one world-class health system for the Gold Coast. So we do work across the breadth and depth of the healthcare system, not strictly restricted to only working with GPs, which is a major part of our work, but also really broadly across every part of the sector. Next slide, thanks, Katie. So we're one of 31 of these companies around the country. We are the Gold Coast Primary Health Network, and that's our boundary, basically the Gold Coast City Council boundary. And each of the organisations around the country works closely with their communities, and our job is to engage significantly with our communities, service providers, to develop a really good in-depth knowledge of the service sector, and particularly the health needs. And you may hopefully have engaged with us in the past in the development of our health needs assessments, which we're continually undertaking and refining. And certainly, please access our website if you'd like a copy or any more information on those. Next slide, thanks, Katie. So these are just our major strategic objectives. As I indicated earlier, we work across the whole Gold Coast health sector. Largely it's fairly straightforward. We identify the health needs of local residents, and hopefully you've been engaged in some of those consultations, or you will be in the future. And no doubt you will be as we undertake a bit of a deep dive needs analysis in the aged care sector to inform these projects. So we do work on a commissioning cycle, which starts with understanding the needs, and from there we design services with all of those people involved, service providers, consumers of the services, etc., and ourselves. So we're largely aiming to address health needs within our region, and then subsequently, once we've designed them with communities and providers, we will fund, or we call it commission or procure the services from service providers in the community. So we don't provide the services directly ourselves. Our role is that commissioning function, understanding needs, designing health services, and then procuring other organisations to deliver those. And then we undertake performance monitoring and management with those commission services. So that's essentially what we do. Was there another slide there for me? Oh, and just our strategic goals. So just to sum up what I've just said, really, our aim is broadly to improve the coordination of care, to ensure people receive the right care, right place, and the right time. So you've probably heard that before, and that relates to the broad role that I told you about, working across the sector. So we're trying to build the bridges and connect services. And as you would all be aware, we tend to unfortunately operate in silos. Our role is largely to break down some of those silos and coordinate services better for the benefit of the patient, who hates to have tell their story to different providers every time they meet a different provider. And then to engage and support primary healthcare providers and other stakeholders in those in the improvements that I mentioned with the services, and ultimately to be high performing, efficient, and accountable organisations. So that's the strategic goals that we aim to achieve and we hold ourselves to. That might be the last one, is it, Katie?
That's it. Thanks so
That
much,
is
Matt.
wonderful. No worries. Thanks, everyone, and I hope you find the session informative and enjoyable.
Thanks, Matt. Okay, so I'm going to provide a bit of an overview of the existing as well as some of the new projects that are funded by GCPHN that support residential aged care on the Gold Coast. So we do currently have a few services and activities that you may be familiar with. So these first up include the COVID-19 support and coordination of in-reach vaccination clinics for residents and staff of RACFs. And that's been running since the beginning of 2021 when COVID-19 vaccinations first became available. So I've left the contact details up there. I'm sure that you are quite familiar with the ladies who support you from our organisation, and I won't talk too much on that because I know Inga is here today to present a little bit later on. Another one of the existing projects that PHN fund is the Psychological Services in RACF's program. So this one offers structured psychological therapies that support people with mental health needs living in residential aged care, and is delivered by the service provider Change Futures. So the service is aiming to support residents who are experiencing mild depression or anxiety, and those having trouble adjusting to changes or coping with loss. So the sessions can be focused on transition into aged care, engagement and wellbeing, and managing identified mental health conditions. And the activities that come as part of that service include structured psychological therapy, group sessions, individual sessions, and education to RACF staff. And the referral process is up there on screen, so individuals can self-refer, but referrals are also accepted from family, the facility managers, nurses, general practitioners, psychologists, and psychiatrists. So then the next project is a more recent one, the Wound Management Pilot Service, which is delivered by service provider Wound Specialist Services. So this service offers a nurse-led in-reach program that provides access to specialist wound advice and mentoring for RACF staff to support that effective assessment, care plan development and management for residents of aged care facilities where they have chronic and complex wounds. The service also offers quite comprehensive online training support, quarterly webinars, and a series of face-to-face practical, really hands-on workshops, with the next one in that series coming up on Wednesday, the 6th of July. So if you keep an eye out in the RACF bulletin emails that we send out. There'll be information on how to register for that. But if you don't receive those emails, you can also find the wound events on our website if you visit the events page and search for wounds. So then coming into the new aged care projects that we have recently been given. So in response to the Royal Commission, as you all know, the government committed $17.7 billion to an aged care reform package as part of the 2020-21 federal budget. So the government's focus through the aged care reform is to just ensure that every Australian can have access to high quality and safe care services, that they're empowered to have more control as well as choice in their care arrangements and be treated with respect and dignity. So the aged care reform package includes specific funding for PHNs, which allows our footprint to extend further into aged care with a commitment of 3 years of funding. And it provides a really significant opportunity for PHNs to deliver a coordinated response to address many of the issues facing the aged care sector, as well as an opportunity to enhance integration between health and aged care services within the region. So we do have 5 new aged care projects that have come to us as part of the Commonwealth's aged care reform. 3 of the projects are community-based, healthy ageing and aged care projects, and then 2 face into the residential aged care. So I'm going to, for today, I'd like to introduce you to the 2 new aged care projects that support residential aged care. So first up is the enhanced after hours support for residential aged care. This funding has come about because there's known difficulties for RACFs accessing after hours services, and it can often lead to unnecessary hospital presentations. So this project's aiming to assist RACFs in the development and implementation of comprehensive after hours action plans that will help residents access urgent assessment or triage services in the appropriate setting when required. The activity is funded until June 2024, and it includes providing support and resources to assist participating RACFs to have appropriate after hours plans, to help support the use of digital health platforms, including My Health Record within RACFs, particularly when there has been an after hours episode for a resident, and then also supporting the engagement between RACFs, after hours services, and the resident's usual GP as part of that after hours action plan development. And then the second project is around supporting RACFs to increase the availability and use of telehealth care for aged care residents. So this funding has come to us because the timely access to primary healthcare professionals is it's a known issue for RACFs, whether it be face-to-face or virtual consultations. So this project is aiming to support RACFs have appropriate clinical facilities and technology, as well as adequate staff training that's required to be able to feel comfortable supporting residents to access quality virtual care from their GP, from specialists, as well as other clinicians. And when we talk about telehealth in context to this project, we're looking at video consultations, trying to improve that in particular. So the activity is also funded until June 2024, and it includes assisting RACFs to have that appropriate telehealth facilities and equipment, to provide training where required for RACF staff to really feel confident with those video consultation services, but also to encourage the increased use of My Health Record. So you can already see there's some symmetries between the 2 projects, and yeah, absolutely needed. From some of the very early consultation that we've had with RACFs, within the Gold Coast, there has been some commentary around things like connectivity being an issue for some RACFs and poor Wi-Fi. So that's very much so within the scope of this particular funding. So from here, to progress this new work, we'll be sending a survey form out to gather information on existing after hours and telehealth processes to help better understand your needs. And we would really appreciate your completion of this survey when you've got time, to ensure that we can provide you with the most appropriate supports to meet your need and better support you and your team, as well as your residents. So we'll also be sending a brief evaluation of this event after completion of this webinar, just to assess how relevant you felt the information you received here today was, and also to identify future topics that you would like covered if we were to do future webinars. But for now, that's all from me. I will hand over to our next speaker, and there will be opportunity at the end of today's presentations if you do have any questions or feedback regarding those particular projects. But I will stop sharing now, and I believe I am handing over to Inga, who is our COVID-19 engagement manager.
Good morning, everybody. Katie, can you just nod if you can hear me okay? Great. Look, I know that everybody is very sick of hearing about COVID and COVID vaccination, so I promise to keep this very, very short. I just wanted to take the opportunity, firstly, to again thank everybody that is on the call for all the work and engagement that you've been doing in the vaccination space to keep all of your residents and your staff safe and vaccinated. I know that there are a lot of demanding and challenging requirements with reporting, so I just want to acknowledge that everybody is doing a fantastic job, and we're really, really grateful of the work that you've done so far and continue to do to keep all residents and staff safe. So very quickly, just a couple of things. I thought I would mention that the InReach clinics for vaccinations continue. No doubt many of you will have spoken to either Robin or Deb in our team here at the PHN, and we are still reaching out to facilities on a weekly basis just to check in with you to make sure that the visits that you've had scheduled have been completed, and of course reach out to see if there's any additional visits that are required. As you will all know, we're very lucky to have a team from the Public Health Unit who have been assisting with vaccinations for the winter dose. And they've also been contacting all facilities to offer InReach clinics, along with the primary care channels of your GPs and pharmacies. And of course, there's also a Commonwealth vaccinator that is also making contact. So plenty of channels for those winter wellness or the fourth dose for residents. So again, just acknowledging that that is ongoing, and if you do need any assistance with organising some clinics for COVID vaccinations for residents or staff, please reach out to the practice support team, to either Robin or Deb. Just so you can see where we're up to in terms of populations and vaccinations, I'll just share my screen with you if we can. Just bear with me. Okay, Katie, can you see that okay? Great. So just some good news. I'll lead with the good news first. And that is, as of last week, the Gold Coast actually had the highest percentage of their staff, RACF staff and workforce vaccinated with the booster dose. So currently on the Gold Coast, staff vaccination rates for COVID are sitting around about 99.15%, which is a really fantastic effort. some of you will have known I presented a couple of months ago, and we were further way down, sitting behind some of our other LGA areas. But at the moment, over 99% of all staff have received their booster dose. So that's really fantastic and speaks to obviously how important it is to get vaccinated for both residents and staff. The Commonwealth has just started publishing data on the winter doses, and as you will have known, over the last month, you've been required to upload that data through the My Aged Care portal. That information has just started to be published, and currently our residents are sitting just under 15% vaccinated. But I would like to mention for that data, I know that not all facilities at the moment are reporting their winter doses. So I do acknowledge that that data doesn't really show a complete picture of what's happening on the Gold Coast. But nonetheless, that's where we're sitting according to the department. So around about 15% of all our residents have currently had their winter dose. So I just thought I would share that with you. And the only other thing I did want to mention was that the face-to-face visits are still available for RACFs. So should your regular visiting GP be unable to attend for any COVID-related reason, there's a referral process in place where your GP, the facility GP, can contact the PHN and make a referral, and we have a commissioned service to do face-to-face visits into the RACFs. Turnaround time is up to 48 hours. It is sort of sitting in between that 24 to 48 hour time frame. But it's definitely available there. So if there are any residents that do require face-to-face care and the visiting GP is unable to provide that for whatever reason, be it COVID related, that service is available. So Katie, am I taking questions now, or shall we hold them over till later? What would you like?
Yeah, if it's okay, I was going to say we'll get, if there are any questions, just if we could hold them till the end, that would be great.
Right.
Otherwise you can, more than welcome to pop them in the chat, but we'll get to those at the end. Thank you so much, Inga.
Well, quick update, I'll jump off. I know you've got lots to talk about.
Thanks so much, Inga. Okay, so next up we have Fiona Vosti, who is presenting from the Gold Coast Public Health Unit, an update on COVID and other respiratory illnesses. So I'll hand over to you, Fiona.
Great, thanks, Katie. Can you hear me?
Sure can.
Great, okay. Apologies in advance if there's any IT errors. So we'll give it a go, and hopefully you might be able to see my screen. Hang on, this one. No, it doesn't look like that's happening right now, does it? Any luck, Katie?
Perfect.
Oh, good. Okay, fantastic. Great. And thanks, Katie, and thank you to the Primary Health Network for the invitation to join this forum today. Unfortunately, we are all sick about talking about COVID, but that's what I'm going to be talking about. So I'll be talking about providing an update on COVID-19 and other respiratory illnesses or viruses that are circulating in the community at the moment. So again, I'd like to reiterate, as Inga has already, mentioned, I'd like to acknowledge the amount of work and activities that facility and clinical managers have taken in conjunction with their staff to protect the vulnerable residents in residential care on the Gold Coast. It's been a very long process. It's very complex. The requirements that residential care facilities need to meet are changing regularly, so it is still extremely difficult. Unfortunately, this week, Queensland had their 1,000th person die from COVID, so that's an extremely sad moment, but we must press on and protect our vulnerable people. So I'd just like to speak also about the number of COVID notifications that we've had since the start of the year, and also other respiratory viruses. I'll just do a brief talk about testing, RATs versus PCR, and the what's the word I'm looking for? The how good the PCRs versus are against the RATs, where we are currently with the outbreak situations of COVID and other respiratory viruses. Just briefly mention infection control precautions, and again, vaccination against COVID and influenza. So I'll move to the next slide. So hopefully we can see here, we're talking about notifications of influenza, respiratory syncytial virus, and then COVID-19 in the Gold Coast. And this data I received this morning, so it's as accurate as we can get. It includes, we're up to week 22 of the year at the moment. So this is up to the end of last week. So on the y-axis over here, we've got notifications of influenza and RSV. And over on the other right-hand y-axis, we've got notifications of COVID. So with the, yes, I'll keep talking. So in the yellow here, we've got COVID. So at the start of the year, after they opened the borders, there was a lot of COVID around, as we were very aware, and the COVID numbers have tailed off. However, we think that that is now due to not everybody is getting tested. You know, people are presuming they've got COVID, or they have a RAT test and they don't register their RAT test on the Queensland Health website or portal. So that's an underrepresentation, we believe, of the COVID cases on the Gold Coast at the moment. And then in the on the blue line, we've got respiratory, on the lighter blue line, we've got respiratory syncytial virus, which seems to be going up quite dramatically week by week, and that can be quite a nasty disease as well. And then in the dark blue, we've got influenza, which has shot up exponentially. We've had over 400 cases in the last week of influenza. So there's a significant amount of respiratory illness going around at the moment, and we believe that the flu and the RSV numbers are again an underrepresentation of what actually is happening on the Gold Coast. This slide is a little bit, it's a bit different from the previous one. So it's just a number of notifications, and this is just talking purely about influenza. It's again Gold Coast specific, and it's by year and week. So we can see back on the brownish line there, 2017, our peak in Queensland, or in southeast Queensland, for influenza is usually around August, September. Usually when the ECA is on, there's plenty of flu around, and we can see that for 2017 it peaked week 33. And then again in 2019, it followed a very similar pattern. In 2018, there was a lower number of recorded influenza cases. And then for 2020 and 21, because the international borders were closed, there really wasn't a lot of influenza. There wasn't hardly any influenza circulating in the community. And then we've got 2022, when borders are open and people are moving and we're all sick to death of COVID. And we've got a very early onset to our influenza season for 2022, and it keeps rising significantly every week. So there is plenty of influenza around at the moment. I'll just move on to the testing regimes and where we are in the outbreak situations for COVID and other respiratory illnesses in residential aged care. So there's been some research done about the reliability of tests, you know, RATs versus PCRs. And I know it's a lot easier for everybody. Everybody's got their RATs at home, and residential care facility has their processes for RAT testing for staff and visitors through their recommended guidelines. So if somebody is RAT positive, there is no need for further testing. A RAT positive is fairly accurate. It's only the estimates that I've been advised of, that only 1 in 100 positive RATs will be incorrect. So it's it's highly likely, if you have a positive rat, that you are positive for COVID. If you have a negative rat with symptoms, you will require a COVID PCR. So you can still present to the fever clinics at both GCUH and Robina hospitals and have a COVID PCR. The reliability of rat negatives, just if you're rat negative, it doesn't mean that you don't have COVID. And so that's why we are recommending the PCR. Advice I've received that 1 in 3 negative rats is likely to be incorrect. So we have a lot of false negatives. And that's why we need the PCR, because that is the gold standard for testing. If we have a rat negative and a COVID PCR negative and people still have symptoms, then especially if they're staff, they need to be excluded from the workplace until symptoms have resolved. Not everybody is having a multiplex test, which means they're not necessarily being tested for influenza or RSV. If you do have respiratory symptoms, you need to exclude yourself and stay at home and look after yourself, and then you can return to work when your symptoms have resolved. I've sent an email yesterday to the fever clinic at Robina and GCUH asking if residential care facility staff do present to their clinic with symptoms, if we could get some multiplex testing. Obviously, the staff would need to identify themselves, bring their ID badge. At the moment, I'm awaiting a response to that email, so that actually isn't happening at the moment, but I think that would help in diagnosing the respiratory viruses that are circulating in the community, especially with residential care facility staff. I hope all that makes sense. I seem to have made a bit of a dog's breakfast of that particular issue. At the moment, we'll move on to outbreaks. There currently are 9 facilities on the Gold Coast with COVID outbreaks. We don't have any mixed COVID and other respiratory illnesses outbreaks at the moment, so that's good news. But however, we do expect the situation to worsen as we move into winter. I'm not sure about the audience, but there seems to be plenty of people that are off work sick or caring for people that are that do have respiratory symptoms. So as we move into winter, the situation will get a little bit worse, unfortunately. So just in regards to infection control precautions, just a little reminder, cases are not to enter vulnerable settings until 14 days from the date of their positive test, and close contacts must not enter vulnerable settings until 7 full days have passed after the test date of the case. And then when they do come back to work, then they need to wear a mask for the following 7 days. And so if you're looking for where the guidelines are, it's as documented here on this page. And then it's really important for staff to continue to use the appropriate PPE, especially visiting allied health, especially all staff, but also allied health staff who may not be compliant with the processes. So it's up to all staff just to keep an eye on visitors as well as visiting allied health staff, so that we can ensure that the vulnerable residents are protected against COVID and other respiratory viruses. So Anastasia Palaszczuk made an announcement last week that there was free flu vaccine for everybody over 6 months of age in Queensland. And so there is a super clinic at Southport High School being held this weekend, Saturday the 4th and Sunday the 5th of June. It's a drop-in clinic, there's no appointment required, and we are offering free flu vaccination and also free COVID vaccination. So I believe there's plenty of parking at the Southport State High School. There's also a market on over the weekend. So the clinic will be located in the music room at Southport there at the high school. And if you could just enter through gate 3, that would be good. And we're expecting a big uptake for the flu vaccine. Our community clinics that have been last week at Robina had over 150 people present for flu vaccine, and then the week before there was again similar numbers, another 150 people. So we're aware that GPs and pharmacies also are offering free flu vaccine as well as COVID vaccine, but this is an opportunity for the whole family to present on the weekend to receive their flu vaccines. And there's also a flyer here for the community clinics that the community immunisation team run on the Gold Coast. And there's the sites that we have, the 7 sites, which I think the Helensvale one will be, the Helensvale Community Centre site will be updated. So if you are planning on going to any of those clinics, you might want to just check with Gold Coast, do an internet search for Gold Coast immunisation, and that will have the latest information. Katie and everybody else, that's about it for me. I'll stop sharing that screen.
Thanks so much, Fiona.
No worries.
I was just noted Fiona does need to head off now. If you did have any questions specific for the public health unit or relating to her presentation, I would still encourage you to either pop them in the chat, or you're more than welcome to email them through after today. And Fiona has said she's happy to, she'll get back to any of the facilities that do have questions.
Great. Okay. Thanks, Katie. Thanks, everybody.
Thanks, Fiona. Okay, so we are making good time today. We have next up an update from our Gold Coast Health RAS team with Julie Eastham and Dr. Rebecca Shaw.
Thanks, Katie. I am also just going to try and share my screen. Just bear with me. Can you see that?
Yes, perfect.
Yes, okay, perfect. So I am just going to talk to you guys a bit and give you an update about our RACF acute support service. The aims of the RAS service are to try and optimise the quality of care for residents of RACFs with acute healthcare needs across the care continuum by providing additional support to RACF residents and staff. We want to try and improve resident choice and options for site of care delivery for those who would otherwise present to ED, where it's clinically appropriate and also in line with their goals of care. So we have a few components of the RAS team. We have the outreach team, which is available to act as an ED alternative where clinically appropriate and be able to treat the residents where they are in the RACF. If patients have unstable vitals or they want to be transferred to ED, they should still be facilitated by a QAS. And if they do need to be seen in hospital, then we will help support that process. We have a team that consists of senior doctors, including ED consultants and geriatricians, and senior nursing staff. And our remit is to provide clinical advice and support for RACF residents' acute care needs. We're essentially aiming to offer a HIF-like service for RACF residents to try and help provide the equivalent of in-hospital care, but in their own setting in the RACF. We're also able to provide direct telehealth with RACFs, and we'll help try and facilitate that where we can. But we can also go out and visit the patients. And we're not aiming to provide a GP substitution service, but we want to work collaboratively with both GPs and the staff at the RACFs. We also have an in-reach team to support residents when they are in the hospital. So our team will liaise with inpatient treating teams, GPs and RACFs to coordinate discharge back to the RACF, improving the continuity of care the residents receive. And we also do follow-up phone calls, which are provided after discharge to identify any concerns that you may have and address them. We also have a mobile imaging service that isn't directly available through us, but we work collaboratively with Aged Care Imaging, which is a service that provides mobile X-ray and mobile ultrasound within the RACF, so that the residents can have their X-rays and ultrasounds where they are without needing to go anywhere. We also have a telephone triage line, and that's the number on the screen. So that's currently available 8 AM till 5 PM, Monday till Sunday. It's staffed by senior nursing staff from the RAS team and provides a single point of contact for RACFs and their associated GPs. We also have a suite of care pathways that are available to follow and help assist in the recognition and management of residents' acute care needs. We are still working in line with the COVID-19 guidelines that are available for the RACF through the CDNA, and any advice and service provision that we provide in relation to COVID is in alignment with the guidelines and documents that you guys have been provided, and we are here to provide assistance with COVID-19 patients who may need some additional support for within the RACF, or also support them if they are being transferred to the emergency department. Our long-term aims are to increase the choice of care options for residents of the RACFs. We aim to avoid the ED and treat the residents in the RACFs to minimise their exposure to COVID-19 and other iatrogenic conditions that they might be exposed to by coming to the emergency department, but which reduces their risk but doesn't compromise their care, because we still provide an equivalent service within the RACFs. And we want to facilitate and support acute care interventions, decision making and medication delivery within the RACFs. As I said previously, we don't aim to replace or duplicate existing GP cover, but to work with the GPs and the RACF staff so we can make plans together. And that's just our contact number again. And that's just some the numbers for the palliative care consultation line. There's one available for the doctors and for nurses and allied health in business hours, and we do also work collaboratively with the space team, but I'll let Nicola talk to you a bit more about that. Okay, thank you.
Thanks so much. Okay, and again, if you do think of any questions as we go, you're more than welcome to pop them in the chat or wait till the end. But last but certainly not least, we have the Space Girls. Sorry, I should stop calling you that.
No, that's good.
The Space Girls. So Dr. Nicola Morgan online to provide an update on the space project.
Thank you very much. Let me not be the only person who couldn't manage to share their screen, because that'd be kind of sad. It'd be about right, but you know.
Perfect.
Okie dokie. So look, I'll just do a quick romp through the space program, because I'm not sure how many of you are fully aware, or it's a brand new concept for you. So I'll just start from the beginning, but fairly briefly. So I'm the medical lead of the project, Nicola Morgan, and Susan here is one of our 2 CNCs on the project. I'll show you the team in a minute or two. So just a bit of a background, I mean, we already know that it's a growing and unmet need of in Australian RACFs, that we're looking more and more at end-of-life care and complicated end-of-life care. 36% of all Australian deaths are now occurring in RACFs, and the average length of stay in an RACF for a resident is now 18 months. So the majority of people going into an RACF have got complex end-of-life issues from the get-go. Yet we know that specialist palliative care is not a standardized component of RACF delivery and still not supported by regulatory framework, although there's been an awful lot of movement forwards following the Royal Commission findings. But what we do know, and the literature is really, really clear on this, is if you do get specialist palliative care support into RACFs, then there's improved symptom management, there's reduced hospital admissions, more people dying in their place of choice, which is almost always the RACF, and the increased planning enabling all that lot to happen. And the result of that is that there's actually a released capacity back into the hospital system, and I'll show you some figures on that in a minute from our point of view, but this is what the literature shows. So here's the Gold Coast. Our beautiful Gold Coast actually has the largest proportion of over 65-year-olds in the state. We've got 58 RACF facilities, and prior to 2019, we had no specialist palliative care outreach into RACFs at all. So at the beginning of the pandemic, we partnered with RAS and actually provided a temporary traditional specialist palliative care service. So I would call it a reactive service, in that people put their hands up, ask for help, we go out there and try and sort the problem out. Reactive service. In 2021, we actually introduced a proactive service, so anticipating needs and enabling things to be sorted before they reach crisis point. And we'll talk about that some more. So as I said, historically no visiting service in the Gold Coast, and many residents have got these complex end-of-life care needs, significant healthcare utilisation. So in 2019, 25 residents from RACFs presented to Gold Coast hospitals, to Robina and Gold Coast, every single day on average, and 11.5% of hospital admissions across the hospital and health service are from RACFs, and 16% of all hospital and health service deaths are actually from RACFs. So along comes the SPACE project, jointly funded through the Australian government's Comprehensive Palliative Care in Aged Care measure. In 2020, they went to all of the states and territories and said, if you match our funding, we'll give you X amount of money for projects to improve specialist palliative care going into aged care facilities. Every state and territory said yes. And in Queensland, the SPACE programme was created. So there are actually 15 space projects across Queensland, and Gold Coast is just one of those 15. They commenced in 2020 and will continue through till 2024, and I'll show you what that looks like for Gold Coast in a second. The main aim is to improve access to specialist palliative care for RACF residents, but all of the projects are aligned with some set service principles, and the main principle there really, which I should have put at the top instead of third, is capacity building with our RACF colleagues, which is why our programme has very much focused on proactive management and upskilling. And the goals of our service really, as I said, to improve that capacity and this preemptive planning to avoid crises and avoid unnecessarily hospital transfers, and then give people the best quality of life we can in their place of choice. So here's the Gold Coast space funding, and you'll notice in brackets afterwards that in fact we are triple funded. So that 250, 550, 550, 350 is joint federal and state funded, and then on top of that the Greater Choices additional funding through the PHN, which really enabled our service to reach all of the RACFs rather than just having to choose a select number of them given the amount of funding we had, and also enabled us to continue a reactive arm of our service where necessary for those people who still manage to fall through the nets. So here's our project team, and myself as the medical lead, Tracy Norling is our full-time nurse practitioner, Stacey is our project officer, Ewan is my advanced trainee, and then Lucy and Susan are our CNCs. And as I said before, Susan is employed through PHN funding, and hugely grateful. It actually made all the difference in our service. Turned us from a struggling project into a service. So here's palliative care needs rounds. So just a little bit of information on those. So really, they are actually a proven model of care which involves monthly clinical triage meetings. And what we did is we went into all of the participating RACFs and upskilled the staff members right from the care providers all the way through to managers on how to recognize deteriorating people and then bring them to a monthly round, and then actually integrating case-based education, which the literature shows is the best way of getting that advanced level of learning, chaired by one of our team. You saw our members before, multidisciplinary clinics, and up to 6 people discussed per month from the RACF, and then all of the preemptive planning put in place so that when the inevitable happens, everyone's ready. The family are ready, the GP's ready, there's prescribing already in place, thought processes have had, meetings have already been had, and hopefully things therefore go a lot more smoothly. So some of the feedback we've had on space in the last year. How am I doing on time? Probably over talking as usual.
No, you're good, Nicola.
I'm good. Right. Okay. Very well received by our RACF and GP colleagues. In fact, funny story, one of the RACFs who hadn't been interested in joining the space project contacted us the following week and said, actually, we do want to join. So we said, why? He didn't like us last week, and the answer to that was our GP says that they'll refuse to come and see us anymore unless we join the project. So I think the GP was probably fairly keen on that project, but the RMs in the RACFs are reporting it's assisting them with better symptom management, and the staff are feeling much better supported. So key benefits to date from a patient point of view, there's improved symptom control. I'll show you some figures on this in a second. Increased number of people dying in their place of choice, reduced admissions to hospital. From a system point of view, we're actually releasing capacity in the hospital system by avoiding unnecessary hospital admissions, and then streamlining appropriate hospital admissions, which then tend to be shorter in duration as well. And space is very much valued by our RACF colleagues. And one of the ways that we saw this was when a lot of the RACFs were under lockdown with COVID. The second they started coming out of lockdown, we started getting phone calls demanding that we restart the service immediately. And in fact, most of our team members had been deployed to acute areas, and I ran around like a headless chicken for about 3 days getting everybody back again, because that's what the RACFs needed and required from us. So last month we celebrated our first anniversary of our first ever needs round, and here are some of the results, which I'll let Susan talk through.
So in our first year of needs rounds, we've been into 91% of the RACFs on the Gold Coast. We received 809 referrals. 273 of those were proactive, preemptive palliative care needs rounds. We also had 144 urgent resident reviews with 68 family meetings, 161 clinical telephone support calls. We've liaised with 130 Gold Coast GPs and provided education sessions to 130 facilities comprising of nursing staff and care workers. So it's been a big year.
Absolutely. So we may have celebrated with some non-alcoholic wine at work. So just pretty much last slide here. In that year, we actually were very fortunate in that we collaborated with Bond University, and I actually supervised a data analyst student for their master's project, and they actually looked at some of the data that we were creating and created a real-time dashboard for us. But this is quite fascinating, so I'll just show you some of this. So we know that on average we've got 130 residents reviewed by Space every month, and what we know is that between 2019 and 2021, so this blue line is 2019, these are ED presentations right the way across the Gold Coast. 2020 is the orange, and 2021 is grey here, and this is 6-month period chosen for each one. So blue line basically is no RAS, no space. Orange line is RAS with respect, which was the reactive arm of Space. And then the grey line is RAS with Space. So what we know is that RAS and Space are extremely effective, and we've had a 25% reduction in ED presentations because of the pair of them. But we know that adding that proactive arm on top of our reactive arm has an additional increased benefit. So we know the RACFs came on in a step-wedged fashion. So when we were doing this 6-month report, we could actually look at the RACFs that were conducting space rounds and those who weren't conducting space rounds. And what we do know is that those who were not conducting space rounds, their presentations to ED went down 8%, and those who were conducting space rounds, their presentations to ED went down by 31%. And in that period, all presentations to ED increased by 8%. So it's not some kind of nobody ever goes to ED anymore, which we know isn't true because we know how busy they are. So that's kind of amazing. RAS and Space are awesome. And that was it.
Thanks so much, Nicola. Okay, so that wraps up our speakers for today. And I guess I want from here to thank all of our speakers who gave their time to present today, but also a very big thank you to the RACF staff online who took their time today to come off the floor to attend. We appreciate that's not always easy to do for you, but especially so in the current climate. And I just wanted to let you all know that we will make this recording available, and we will circulate the link to it via email so that you can share it with any of your colleagues who may find it useful if they were unable to make it today. So from here, we'll stop recording.